Hi everybody, and welcome to What is Your Pharmacy Business? Last week you should have watched the lecture about what is a niche and how can a niche help your business. And hopefully you watched the video about the purple cow. It's an older video that I recorded years ago, but it's still very relevant today. So today we're going to talk about what is your pharmacy business. And we're going to talk about the different aspects you have to think about in starting your own business. Today's lecture is an overview. This week there will be no assignment due because you should be working on your niche assignment, which is due next Friday the 27th. So let's begin. The key topics I want to discuss today is having you think about your pharmacy business. And it doesn't have to be a traditional community pharmacy. There's nothing wrong with it wanting to be a traditional community pharmacy, but one of the things we'll explore this semester, and if you continue on next semester, is that to be a successful even community pharmacy, you have to have niches and different types of services to offer to be able to be relevant in 2019 and beyond. So we're going to talk about what are those opportunities today and beyond, and we're kind of going to go over the basics about organizational structure of a business, and later on this semester we'll talk about the organizational operations in operation management. You'll be writing a business plan next semester if you continue on with the concentration, and your business plan is going to be your business plan of your own idea. A business plan for a business is multiple things. It is the beginning map to the road of success for your business. It is also a way for an investor, whether it's a bank, somebody wanting to give you money or partner with you, to see why this is a good risk. No bank goes into lending money if they don't think it's low risk. And so when you write a business plan, you're going to give an historical evolution of either where this current business is or what the business idea you have and how there is, good, structure and good thought through of why this will be successful. Other things in a business plan is you'll talk about what the legal structure of your business plan is, what products and services your business is going to offer, an analysis of the location you want your business to exist, going over the organizational structure of your business, and also making sure you let the investor know that you're going to be insured and security and everything that goes on in having a successful pharmacy business. But what type of pharmacy business do you envision that you want? It could be in a community setting for patients to walk into your business, an ambulatory care setting, a partnership with a physician's practice. It could be an institutional pharmacy business where you take care of nursing homes, personal care homes, home health, hospice. It could be a consulting business where you are the clinical pharmacist providing services to different types of entities. Maybe you want to develop a new type of technology that will help pharmacy business. So what are the different types of pharmacy business models that exist today? Well, we traditionally have community, hospital, and skilled care, but there's numerous opportunities in clinical, consulting, and technology. The biggest thing that we will explore this semester and next is for a business to be successful, it has to make money. It has to be able to pay its resources, salaries, operating expenses, and the ultimate goal of going into business for yourself is that there's a reward that is beyond what you would have versus working for somebody else. There's numerous types of entrepreneurs out there. And, there's lots of different examples. You could have your own private MTM business. You could have an online forum for pharmacists to meet other pharmacists type of business. So you might have a business where you're providing, a way to share technology or a way to share business ideas. You might be a nonprofit organization that provides MTM and vaccine services for homebound seniors. You might be a business that teaches pharmacists to become prepared to be certified. You might be a writer who is a consultant for national publications. And you might develop your own online audio-based consumer medication information. So there's numerous ideas out there. These are just examples. But an entrepreneur, as I said, does not have to be a traditional store. Or your niche idea could be part of your traditional store and is another stream of revenue to help offset other expenses you have in your pharmacy business. There's numerous challenges we have in the pharmacy world today. Traditional community pharmacies have to look at the fighting of reimbursement and, with health plans. We see that, although it hasn't happened and it's kind of stalled, we are seeing this vertical integration of pharmacy benefit managers and health plans wanting to buy each other. CVS Health wanting to buy Aetna, Cigna wanting to buy Express Scripts. In this past year, we saw PillPack, Adherence Packaging Company, purchased by Amazon. How does that face the challenges? But with every challenge, there are opportunities. We have an opioid crisis going on in our country. How could pharmacy play a role in this? We have people that are insured, but in a lot of ways are underinsured because they have high deductibles, donut holes, co-pays, and so we have people not able to afford their drugs. We have an adherence problem with chronic disease leading to unwanted hospitalizations and ER visits. We have now opportunities to be compensated differently as a pharmacy, whether we are part of a pharmacy care network in our state or we're looking to partner with physicians and finding ways to bill. There are challenges in the community pharmacy world to make money the traditional way of filling a prescription. Although there is, the negativity of that, there are ways through Medicare and Medicaid, if we are more efficient in med synchronization, med adherence, we may be able to do this. We have to have better trained technicians, making sure our workflows, because we're filling a lot more prescriptions than we did in the past, to prevent dispensing errors. And government regulations, this past year we have to address this new hazardous waste regulation. Here in the state of Pennsylvania, we have to adopt the new e-prescribing for controlled medications. Though there's always challenges, and somebody could look at all these challenges and say, it's not worth to go into business. But if you study any business in any field, those who succeed look at those challenges as opportunities. How can I take those challenges and make them a win-win for somebody? So you always have to stay up to date of what's going on in pharmacy and what are those opportunities. What are the barriers in a business that I have an idea? One of the things that I will work with you next semester, if you have a business idea, is we'll look at what are those barriers and how you can overcome them. What are some initiatives to develop a new revolution of a pharmacy type of business? And that is why I have you exploring this niche market idea. So, as you are working on this assignment, think to yourself, how would you approach the trends shaping the future of pharmacy? Are any of these trends impacting how you would look at pharmacy? How would you meet the needs of patients, customers with these trends? Additionally, how can your pharmacy business address the rising cost of health care, the increased script volume, taking care of our elderly patients, cost containment, mail order, safety, diversion, self-care? Lots of opportunities out there in practice and change. Whatever pharmacy business you are thinking about, you want to become the expert at. So you have to think up to yourself, what are my current strengths? What are my current weaknesses? What are opportunities? What are threats? You need to start thinking about what would customers want and how would I deliver that. In my, one of my teachings is I'm an expert in geriatric pharmacy, and one of the things we always talk about in geriatric pharmacy, when you start a new medication, you start low and go slow. So maybe your business idea, you start out small. Maybe it's just a niche as part of a traditional community pharmacy business. One of the things we always want to do is look at and study businesses that have struggled. Circuit City, Best Buy, BlackBerry, Apple, Microsoft. Now these are all technology businesses, but they have all struggled. Some don't even exist anymore. And what were their struggles? Well, a lot of them are they adaptable to the changes going on in their industry? How do consumers buy product now? In our industry, what services do consumers need, whether it's partnering with payers, providers, and patients? Whatever business idea you have, you also will have to form a legal structure. You'll have to think about licensing. What does the boards of pharmacy, depending upon the state, require? The acquiring of liability insurance, and making sure we are following HIPAA regulations. So anytime before setting up a business, you have to do your homework, and that is research, research, research. And this current assignment you're doing is the beginning of your research. What niche idea could you do for your new pharmacy business? What would your pharmacy business name be? And so to ensure your business name, a couple things you have to do. You have to see, does this name exist already? You would also have to obtain appropriate licenses for the business. What would I need from federal, state, and local? We will, if you are a traditional community pharmacy, you have to apply to the Board of Pharmacy for a pharmacy permit. If you're going to sell things such as food or other types of, products, sometimes you have to get state and local licenses. You have to obtain insurance, such as liability insurance, theft insurance, fire, and you need to decide on your business structure. And the most important thing, and you'll hear me say this multiple times, the two most important people you'll consult in the starting of your business is A, a lawyer, and B, a good certified public accountant, because they are going to help determine to you how to set this business up legally, and also how to set up the best appropriate business structure that will minimize your risk and minimize your tax risk. So as I said, you want to ensure your business name. What's in a name? A name, it creates your image of your company. So make sure whatever name you want to pick for your company, make sure that name fits your business. Make sure that company name is easy to pronounce, spell, and remember. You also may want to think about what does your website name, and maybe it's a shortened version of your current business name, or can you use your business name for your website? Even if you don't have your business today, you can actually at a fairly cheap price acquire the website name for your future business. I have two business ideas that I have not started myself, and I pay, I think about $20 a year to ensure those two website names so that they're not taken. Make sure that the name you want to pick allows for growth of your business. If you've followed recently, Dunkin' Donuts. Dunkin' Donuts has now changed their name to just Dunkin'. Why? Because they want to expand beyond just donuts. They want to expand on coffee, different other types of breakfast entities. And so they want to take out the donut name. Although it hasn't caught on all over in the country, they are changing their name. So you need to think to yourself with some businesses. I use Netflix as an example. Netflix picked a perfect name. When Netflix first was, going to be a company, they were a company where you would acquire DVDs to rent, via the mail. But you think about, what is Netflix now? They are an online streaming company, and the word net perfectly falls into what their name is now. Research the names to make sure they're available. Is your business local? Is your own name part of your business? Do you want a logo to be an integral part of your business? Do you plan to have a website? You need that domain and need to insure that domain. Now, you could go out and hire, an expensive marketing firm that could help, come up with your logo and brand. But before you spend that money, start researching it yourself. If you want to insure your business name and domain, if a corporation, it's insured when you incorporate. If you have a business name, what you do is you file with the county clerk in your county, and then you publish your fictitious name. And that fictitious name is published so that it becomes public and nobody else can take that name. To operate within the law, you have to apply for a business license or a permit in the city or county, and it's proof to the IRS that you are a business, because if you are a business, your taxes, the way your business structure is set up will be, determine how you're taxed. Sometimes you have to acquire a seller's permit, and this is required if you purchase items for resale, provide a taxable service. Boards of pharmacy, at least in our state, currently do not look at if you are not dispensing, you are not currently do not look if you are not dispensing, you are not practicing pharmacy. So you may not need a pharmacy license unless you're providing prescriptions. However, in other states, they may require other certifications to be able to do consulting. You may also need to look at the state's laws if you want to do clinical services where you partner with physicians. So you may have to do a collaborative practice agreement. If you want to do immunizations, you or your pharmacist may have to get additional license for that. If you want to dispense narcotics or controlled substances, you'll need to file for a DEA license. The other thing you'll do is you'll obtain insurance. The best advice that I've gotten from about obtaining insurance for a business is find out the different companies that are in your area, or even national companies that offer insurance for your business, and bid it out. Sometimes it's best to hire a consultant in the insurance business, and you go to them and say, you know what, I'm not going to hire you for any of what you're selling, but I'm going to hire you to tell me what are the insurances that I need for my business and how much do I need. By hiring somebody to be a side consultant to do that will allow you then to know what you actually need, so then when you bid it out to other companies, you can make that choice. If you're going to be a local, business, you may want to also bid that out to the local companies to show them you're part of your community. But generally, you need general liability, professional liability, fire, workman's compensation, product liability to help prevent against theft, health insurance, business property, and disability. The next thing you need to decide is on your business structure. And this is where a CPA can help, and a lawyer will help draw up, the articles of agreement of that structure. You can either be a sole proprietor, a partnership, or corporation. To kind of give you an overview of those, I'm going to give you the potential advantages of them and the disadvantages. And when we go into your business plan next semester, we'll talk about the pros and cons of all of them. A sole proprietorship is the easiest and least expensive. You're the sole owner of the profits and losses. Your total control and less reporting. Your taxes as an individual. This may be good if you're doing some side consulting type of business. The disadvantage is there's unlimited liability. You're responsible for all the debt. Less available capital, loans based on individual financial strength. Limited growth potential. And obviously, the business is endangered if you die, you're ill, or you're injured, unless you are acquiring maybe some short-term or long-term disability. However, for small types of consulting companies just starting out, where you're just doing this on your own and there's not a lot of overhead expense, this might be a good entity and also help you with your own personal taxes. Partnerships. Partnerships, remember, are a lot like marriages. They can be very successful or they cannot be. And partnerships are usually two or more people that agree to share ownership, to access to more available resources, talents, and skills. It's important that the partnership is in a legal agreement. Like I said, it's often is like a marriage. And although when marriages are successful and people get along, they can last a very long time. But when marriages become unsuccessful, depending upon if there's not a lot in writing, it can become very messy and difficult to separate. Disadvantages of this partnership business structure is just a regular partnership is still unlimited liability, and that falls on the multiple partners. Profits must be included on each partner's individual tax return according to their percentage of interest of the company that they own. Everybody's responsible for each other's bad debt. And sometimes it's difficulty to get larger sums of capital because it also depends upon what your credit rating of each of you are individually and what is your financial stability. There are other types of partnerships, though. There's limited liability corporation partnerships. And what this type of structure is probably a lot better for a partnership. Partners' risk is only their investment if they do not participate in the management or control of the business. The advantages: general partners have additional capital to invest. Limited partners have limited liability equal to their investment. And how you allocate income and losses may provide tax benefits for those who are investing. So you could have multiple partners that are silent partners that are just investing and using your great business ideas and your great business skills to benefit by getting some of that profit that you might. Disadvantages is limited partners have no control over the management of the business, but partnership profits are taxed as income to the partners. And so one of the things in these limited liability partnership corporations is you'd want to set up the structure of how taxes are covered, how they're distributed, and how management is run. Corporation is not recommended for most pharmacy businesses anymore because it's more expensive and it's a regulated structure. It's a distinct legal entity separate from the individuals who own it, so the corporation owns its own assets and assumes its own debt. However, people may be taxed twice, so your income on the corporate is taxed and so is your individual salary and any of the dividends you receive. And so a lot of pharmacy businesses aren't large enough to benefit from the discounts corporations can get or the tax breaks, and so it's not always the best structure. There are advantages to corporations because ownership is easily transferable. There's increased opportunities for growth and fundraising. Shareholders are only responsible for the amount they invest, and the authority can be delegated. So corporation could be something is if your business finally gets to a large standpoint, it may be worth to incorporate. So you can always possibly change your business structure. There's a cost to that, and sometimes tax laws allow you only certain time periods in the business can you do that, but you could incorporate further down the road. The disadvantage is there's extensive government regulations, stockholders' meetings must be held, higher cost of forming and maintaining a corporation, and as I mentioned before, the double tax. One other good entity might be an S corporation. S corporations are what a lot of traditional community pharmacy independent owners have today. They allow small businesses to have its income taxed to the shareholders as if the corporation were a partnership. So there are specific conditions for an S corporation. You cannot have numerous shareholders, and only one class of stock is allowed. And a specific portion of the corporation's receipts must be derived from active business rather than passive investments. The other is the limited liability company. Just like the partnership one, it is a legal structure that allows owners the protection from personal liability to corporate structure and pass through taxation of the partnership. The advantages: limited liability partners have complete management and control of the business. If it's greater than 15 to 20 partners, it's better to form a corporation. Limited liability works well with professional services, works well for startup companies. They can deduct losses. The disadvantages if we have more than 20 partners, and then the other thing is all states require limited liability companies to file an articles of organization. You could be an independent contractor. You could be a consultant, often chooses this structure. Like vendors, except they perform intangible services. The biggest thing is, in the eyes of the IRS, you have to be deemed independent. Independent. The company specifies only desired results of the project, and the company does not have the right to direct the person with respect to where they are. But how you get paid by this company is very important, because you can only be, if you're an independent contractor, you have to take care of your own payroll taxes. So those are the different types of structures. My overall advice, though, is save your money down the road, so that when you think that you're going to want to start your business, you can get a good accountant and a lawyer to help you. The additional person you may want to hire one time is somebody in the insurance world that can do an analysis of what you have. So know what you know, but seek advice for those. Once again, you want to come up with what is your name and your, of your business. In the organizational structure of your business, you'll have who is the owner and who are the employees. What are the positions of your business? What is the different roles and responsibilities? So for example, in a traditional community pharmacy, we have the pharmacist manager, we have the staff pharmacist, we have techs, we may have certified order entry technicians, we may have field techs / clerks. So know what the organizational structure of your business is. So this is an overview of what is your pharmacy business. The last couple of slides, I just want to kind of share with you different types of businesses. So the first business is about Mika Finnan. Mika Finnan is the founder of Medication Advisors. And Mika won a foundation grant by the American Society of Consulting Pharmacists. The one thing is, the American Society of Consulting Pharmacists, NCPA, the National Community Pharmacy Association, embraces entrepreneurs. And a lot of times they may have different types of funding, or they may be able to give you resources for funding. Well, anyways, Mika wins this entrepreneur award. And her business is the following. It is a business that centers on forming a relationship with three distinct geriatric markets in her area. She works with a retirement, independent living community, geriatric care managers, and private pay patients. And she sees that these people don't get offered traditional pharmacy consulting services like a skilled nursing facility. And so her goal is to offer services where she can review to make sure the medications are appropriate, get rid of medications to help reduce cost, help patients determine what Medicare plans they may pick. And so how does she grow her business? Well, she starts it by just going to communities and giving presentations on medications and diseases, and shows how pharmacy business can help people. So she starts her business by developing relationships. So her marketing is in this field. Basically, she shows how medications can lead to hospitalizations and increased care. So because of these ideas of her business and how she can possibly delay people from being, having to go out of independent living care, she concentrates on geriatric care managers who work with Health and Human Services to help family members when their, elderly, loved ones are having difficulty. And so she has developed a reimbursement model for this. She even has developed a website for referrals on how to do this, and has developed a pay structure for doing that. The last entrepreneur I want to share is a gentleman named David Pope. David Pope is from the state of Georgia, and David graduated, as a pharmacist. David worked for an independent pharmacy company for years, but he saw that, with the reducing revenue, what we were getting in prescription fills, there was a need for pharmacists to get more clinically involved. So he first started his business called CreativePharmacist.com, and it taught pharmacists how to become certified diabetes educators, how to bill for diabetes education, and they even expanded that to asthma and cardiovascular disease, and then also smoking cessation. But he found that one of the things when he was developing these services, and he developed a business where he got paid by pharmacy businesses to help them develop these services, he found that there was another need. How can they bill for these services and document it? So he started developing a software program called Strand. And Strand then focuses on how clinical software can interact with other entities such as payers, health plans, and physician practices and hospitals. And because of his desire for this, the business grew. He also partnered with a gentleman who understood the writing of this technology. And David grew this business. In fact, Strand is actually the software company that current Pennsylvania Pharmacy Care Networks. David's business grew. Now, like all entrepreneurs, David enjoyed this business. But sometimes what happens, and entrepreneurs can benefit from this, is the business got to a point that he just didn't have enough capital or enough, manpower to take it to the next level. So David actually sold his business to Omnisys this past year, and Omnisys actually acquired David to be the director of new services. And so David put a lot of hard work over the last 10 years in developing this business, and his reward was able to sell it, to make a profit from selling this business, but to see this business continue on. So some entrepreneurs may not want to do this. They just want to own their business for their entire life. Some entrepreneurs have exit plans where then they decide that they need to pass the baton to somebody else. So as you begin to work on next week's assignment that you should have been beginning to work this past week in videos, think about that niche pharmacy market idea. How will this idea revolutionize the current pharmacy practice? Who's the market for this, do you think? Who's your customer? And do you need to create your own market? Maybe that customer doesn't realize this is a need yet. So when we meet in a couple weeks, and I will be sending out a doodle of opportunities for us to schedule to meet via Zoom meeting, we will talk about this. Like I said, this semester, the fun part of this course, and being an elective course, is for you to discover your own ideas. I also apologize, there was a little bit of delay in getting the feedback for you on your current assignments. Those will be coming. I said they were going to be coming last week, and I apologize that did not occur. They will be being posted this weekend so that you can just kind of see and reflect. I'm looking forward to talking and meeting with all of you in the coming weeks, and please do not hesitate to reach out to me if you have any questions. Thank you.